We move on to the pelvic girdle for the lower limb. We're going to stay on the left side. So here's the pelvic girdle with the two pelvic bones, also known as the os coxae. They are each composed of three bones. So there's the ilium, the ischium, and the pubis. You can see the obturator foramen, the large hole there. You can see the iliac crest. You can see the anterior superior iliac spine, anterior inferior iliac spine, and on the posterior side you can see the posterior superior iliac spine and the posterior inferior iliac spine. You can also see on the lateral aspect the large socket for the ball and socket joint of the hip, and for the hip that's called the acetabulum, is that deep fossa. Then the ischium, that's the bone that you sit on. And in the center here, or sorry, more medial on the pubic bone, is the auricular surface, which articulates with the sacrum of the vertebrae. And the pubis, the pubic bones come together at the pubic symphysis on the anterior surface. Moving on to the femur, we have the head of the femur, the neck of the femur, we have the greater trochanter, we have the lesser trochanter, the length of the femur, with the patella sticking, projecting forward or laying on the anterior surface of the femur, of the condyle of the femur. Moving around to the posterior side, you can see the condyles of the femur. Those will always face posteriorly, large rounded surfaces that articulate with the tibia on the condyles of the tibia. Posterior, you can see again the greater trochanter and lesser trochanter, and the head of the femur, which fits into the acetabulum. Okay, continuing on down to the tibia, where the tibial plateau, the flat parts, the condyles of the tibia, with the tibial tuberosity, right in front where the patellar tendon attaches. We have the ridge of or the spine of the tibia, and distally we have the medial malleolus of the tibia here, making part of the ankle joint. Laterally, we have the fibula articulating with the tibial plateau, just underneath the tibial plateau of the tibia. Distally, making the tibial fibular joint, and that the end of the fibula is the lateral malleolus. And we end up with the ankle joint and the foot. So we have the talus, the calcaneus, the navicular, middle or medial, intermediate, and lateral cuneiforms, and cuboid. That'll be the ankle bones. Then we have those are the tarsals. So these are the metatarsals, 1, 2, 3, 4, and 5. We have the proximal phalanges, 1, 2, 3, 4, and 5. We have the middle phalanges, 2, 3, 4, and 5. And the distal phalanges, 1, 2, 3, 4, and 5. These are the pedal phalanges as opposed to the manual phalanges that are in the hand. So pedal phalanges are in the foot.